Hi, my name is Joanne Choi. I'm gonna do the musculoskeletal exam. I'm gonna inspect head in midline, neck in symmetrical to trapezius muscle. Can you put your chin down, up, extension, lateral bending side to side, rotate, and push my hand, flexion, extension, side to side, and rotate. Okay, 5 out of 5 strengths, active range of motion intact. I'm gonna inspect shoulder. Shoulder is symmetrical, and I'm going to palpate sternal notch, sternoclavicular joint, clavicle, acromial clavicular joint, acromial process, and scapular and trapezius muscle, and the bursae and deltoid muscle. No tenderness or crepitus noted. I'm going to do the passive range of motion of the shoulder, flexion, extension, abduction, adduction, internal rotation, external rotation. No crepitus. Can you do it yourself? Flexion, extension, abduction, adduction, internal rotation, and external rotation. Active range of motion intact. Against resistance, put it on my hand. Okay. Flexion, extension, abduction, adduction, internal rotation, external rotation. 5 out of 5 strengths. Now go on to the elbow. Elbow inspect, no deformities noted, and I'm gonna palpate, no tenderness, swelling, heat noted. And I'm gonna do passive range of motion, flexion, extension, pronation, supination. No crepitus noted. Flexion, extension, pronation, supination. Against my hands, flexion, extension. Now I'm gonna move on to the wrist and the hands. I'm gonna inspect. Perfusion is good, no ecchymosis. I'm going to palpate wrist, hands, and finger. And I'm going to squeeze hands. Metacarpal phalangeal joints are no tenderness. Do you have pain? No. And I'm gonna do the passive range of motion wrist, flexion, extension, abduction, adduction. Can you do flexion, extension, abduction, adduction? Against resistance, flexion, extension, abduction, adduction. 5 out of 5 strengths, a passive range of motion, no crepitus noted, active range of motion intact. I'm going to passively abduction, adduction for fingers. Can you do it yourself? No crepitus. Active range of motion intact, and can you push and push? Okay. Abduction, adduction, 5 out of 5 strengths. Now I'm going to do special testing. It's infraspinatus test. Straight your arms, thumbs down, and cross over. Do you have pain? No. And flex your elbow and tuck your elbow. Push out. Do you have pain or weakness? And I'm going to do the Near's impingement test. Do you have pain? No. These tests is for rotator cuff tear. Pain or weakness indicates some rotator cuff tear. I'm going to do the T-nail sign. Do you have pain or numbness, tingling? How about, can you put your hands like this for 60 seconds? Do you have pain or numbness, tingling? Pain or numbness, tingling indicates carpal tunnel syndrome. T-nail sign, Fallon's maneuver is negative. Can you lie down, please? Now I'm going to inspect the hip. No deformity noticed, symmetrical. I'm going to palpate. No tenderness. Do you have pain? Okay. I'm going to do the passive range of motion for the hip and flexion, extension, abduction, adduction, and internal rotation, external rotation. Can you do it yourself? Active range of motion, flexion, extension, abduction, adduction, internal rotation, external rotation. Can you push my hands? Flexion, extension, abduction, adduction, and internal rotation, external rotation. Passive range of motion of the hip, no crepitus, active range of motion intact, and strength is 5 out of 5. I'm going to move on to the knee and trapezius muscle and calf. No deformity is noted, and I'm going to palpate. No swelling, tenderness, ecchymosis noted. I'm going to do the passive range of motion of knee, flexion, extension. Can you do it yourself? Flexion, extension. And against my, push my hands. Flexion, extension. So now move on to the wrist, ankle. And from the fibula head to the peroneus longus ligament and tendon, lateral malleolus, medial malleolus, anterior talus fibular ligament, and calcaneus fibular ligament, and posterior talus fibular ligament, and Achilles tendon, versae, plantar fascia, and fifth metatarsal. I'm going to squeeze feet like this. Do you have pain? No tenderness for the metatarsophalangeal joints. And I'm going to do the passive range of motion for the ankle, plantar flexion, dorsiflexion, plantar flexion, inversion, eversion. Can you do it yourself? Dorsiflexion, plantar flexion, inversion, eversion. Can you do it against my hands? Okay. So 5 out of 5 strength, no crepitus. Active range of motion intact. Toes, can you curl your toes? Okay. So active range of motion, toes are intact. Can you sit down? I'm gonna palpate your patella and tendon. No swelling, it's intact. And can you lie down for me again? So I'm gonna do the special test. Straight leg raise. Okay. All the way down. Do you have pain? No. So pain indicates L5S1 herniated disc. It's a negative. And now I'm going to do the infusion test. Kneel down. And laterally no verge. And then no ballonment. So verge and ballonment test, negative. Now I'm going to examine the collateral ligament. Valgus test, push lateral to check medial collateral ligament. Varus test. Okay. So push medial to check lateral collateral ligament. Now I'm going to move on to anterior drawer test for cruciate ligament. anterior drawer test, posterior drawer test. Now, ligament test. No jerking or popping movement. And now I'm going to do the McMurray test. It's testing for meniscus tear, hyperflexion, and internal rotation, external rotation. No popping sound. Do you have pain? No. It's negative. Can you stand up, please? I'm going to do the active range of motion of hip, flexion, extension. Okay. And I'm going to inspect your spine. Symmetrical. Left side is asymmetrical a little bit. And I'm going to palpate. No tenderness, no deformity noted. Do you have pain? Okay. Now I'm going to move on to active range of motion. Flexion, extension, side to side, and rotate. Okay. And can you put your feet together and hands together and forward? Okay. So one side is elevated than the other, so he has a scoliosis. It indicates scoliosis. Thank you. Yeah.